Hello, my friends. You are listening to Over Keto. Thank you for finding the time to join me. This is your safe space for the next 20 odd minutes where we talk about the reality of disordered eating and eating disorders and how to find peace and freedom from food rules, self-doubt, anxiety and fear of weight gain. Let there be no regret, shame or self-punishment when we eat. I am Mel Wakeman, a registered nutritionist, intuitive eating practitioner, non-diet counsellor and lover of crusty white bread with butter you can see your teeth in. I specialise in disordered eating and recovering from chronic dieting, body dissatisfaction and eating disorder recovery, all through a weight inclusive lens. Please keep your ears plugged in. What's coming up in this episode is right around the corner. Let's talk diabetes, intuitive eating and weight inclusivity in this episode. There is a lot of stigma around diabetes. All types, but particularly type 2. There's a blame culture that exists with the idea that people give themselves diabetes by being lazy and eating the quote unquote wrong foods. But anyone can develop type 2 diabetes. If fatness caused type 2 diabetes, then thin people wouldn't get it. And of course they do. And just to explain, diabetes occurs when the cells in our body have difficulty using the hormone insulin, which we need to turn the sugars in our blood glucose into a usable fuel. It also happens when the pancreas doesn't make enough insulin to meet our needs. So fatness doesn't cause diabetes, sugar doesn't cause diabetes, and we can't eat our way into diabetes. But today, weight loss and carb cutting are pushed as surefire ways of preventing diabetes. And then when perhaps someone does get a diagnosis, that person is blamed and shamed for letting it happen. Oh, and then weight loss is sold because it obviously didn't work as a preventative measure. It's then sold as the cure. So in this episode, I want to challenge the shame that exists around diabetes, particularly when it comes to type 2. I'm going to explain what really affects our blood sugar levels, that it isn't just carbs and exercise. And I want to talk about pre-diabetes, like when did this become a thing? What's it supposed to mean? And does it really tell us anything useful? And of course, we need to talk about disordered eating because it shows up in diabetes care and prevention for both type 1 and type 2. Then come join me at the pick and mix at the end for a few moments where I'll share some key kind of pointers and reminders to help you take the focus away from the numbers, the nutrition specifics to which you don't need to get into for the most part, and apparently exercise that counts, which is sold in diabetes management. So go get the kettle on, find a cozy spot and settle down with me. And in the meantime, if you'd like to follow me on social media, please do. I'm on Instagram as me, Mel Wakeman, and you can find me over on TikTok under Over Keto. And if you want to drop me a message to carry on the conversation or ask me anything, please do, and I will get back to you. Right, let's begin by looking at the different factors that affect our blood sugar levels. And it's really important that we acknowledge these, particularly when folk are looking for a better understanding of themselves and their body, and they're looking for help, because the judgment that exists around this needs to stop. Number 1, genetics. Absolutely, diabetes is predominantly a genetic condition. So yes, that includes type 2 diabetes that can be inherited and linked through your family history. This isn't about blame, this is really having an honest understanding. Number 2, hormones. So we have this collection of hormones that includes insulin, that helps keep our blood sugar levels within normal and safe limits on a moment by moment basis. But there are also other hormones that can have effects too. Now, I'm really interested in menopause transition, and perimenopause can absolutely be a time where women can be more susceptible to larger fluctuations in their blood sugar levels, partly because of the changing and declining levels of estrogen, which has a balancing effect working with insulin, progesterone and testosterone. Another hormone that comes to mind is cortisol. And this leads me to my third factor, which is stress. Chronic stress particularly. Hello. pandemic, post-pandemic recession, war, weight stigma, racism, sexism, transphobia. So what happens is the cortisol makes us make and secrete more insulin. And the aim is to help make more glucose get into our cells so that we can use it and respond to any stressors when we need it. But if that's a persistent increase, then a raised blood sugar level can become problematic. Medications. All medications have side effects. I guess I'm really thinking about steroids right now because these can be used in the long term, and what they do is they make the liver release more glucose into the bloodstream, but they also stop the glucose being absorbed from the blood. And they can reduce the body's sensitivity to insulin. So long-term steroid use can be associated with increased risk of diabetes. Next one, is that number 5? Illness. Particularly when other conditions may damage the pancreas directly, it changes its function. So that could happen with something like pancreatitis, which is inflammation, or something like cystic fibrosis, another genetic condition. What's interesting is also COVID. Now, I supported a number of clients last year who found that their blood sugars rocketed after infection. It was quite transient, but interestingly, there have been some studies since then that have pointed to a raised risk of developing diabetes after having coronavirus. And there are some studies that suggest that people who've had the virus are anywhere between 31% and 166% more likely to later develop diabetes compared to people who haven't had the virus. So viruses can do really weird things to our bodies, and it seems that, affecting blood sugars could be something. Number 6, alcohol. Well, it can directly raise blood sugar levels, but it can also reduce your body's ability to recover when blood sugar levels drop. So it can be a little bit problematic or something to be mindful of if you already have a poor ability to regulate your own blood sugar levels. And also alcohol affects sleep, which is another factor. So the next one is poor sleep, not getting enough of the kind of deep restorative sleep that we need has been linked to higher blood sugar levels. There's things like weather, there's hydration. The one I'm also interested in is our relationship with food. And this links back in again with the anxiety and the stress. And when we experience these around kind of wanting to make decisions around food, around meal times, is kind of what we call anxious arousal, then we get these surges of adrenaline and cortisol that raise our blood sugar levels. And the other thing around problems with difficult relationships with food is that it's more likely to lead to weight cycling, the yo-yoing, the up and down fluctuations of body weight, because we know from weight science that can also destabilize our blood sugar levels and increase the risk of type 2 diabetes. And it's interesting because dieting contributes to weight cycling, and focusing on weight and cutting out carbs is also the main pathway that is recommended. This isn't working, is it? So let's talk about carbs. They alter your blood sugar levels, but they are not the devil. Can we stop demonizing carbs? And I have lost count of the number of times my clients have reported their GP or diabetic nurse saying, cut out carbs. Don't have porridge, don't have bananas, certain types of fruit, even carrots and sweet corn. Their knowledge is absolutely appalling. It's disgusting that people are giving this advice. We all need carbs. Even diabetics need carbs. When we don't have them because we restrict them because we're told we shouldn't have them, that sort of kicks off our program that instigates a stress response. Because when we don't have enough carbs, our body goes into starvation mode, even for a diabetic. So, diabetics are at risk of disordered eating. We need to be really conscious of this. And cutting out carbs does not make you, if you're diabetic, immune from the restrict binge cycle, something I'm going to come on to in a moment. So before we get deeper into this whole sort of carb and food relationship thing, I want to talk about this thing called prediabetes. So it is defined as blood glucose concentrations higher than normal, but lower than any established thresholds that would diagnose diabetes itself. So they're kind of given concentrations of glucose, or there's something like called your HbA1c, which is an average blood glucose level. So it's not actually a diagnosis for anything. And I think what really annoys me and worries me about this is it implies that pre-diabetic patients will eventually get diabetes and everyone who isn't won't get diabetes, and neither of those are true. So some of the numbers that we were told around why pre-diabetes is a thing was that apparently 15 to 30% of untreated pre-diabetes patients would progress to diabetes within 5 years. But where the hell is the evidence to support this? And actually, when you look at some decent evidence and the honest reports, less than 2% per year progress from this pre-diabetic stage to diabetes. And some studies suggest it's even less. So why the hell are we worrying about it? And it's also important to note that pre-diabetes does not increase the risk of heart or vascular disease, nor any other complication associated with type 2 diabetes. So what is the point? Well, it increases the quote unquote need to drive down blood sugars with more aggressive measures, usually in the form of prescription drugs, dare I say it, in exchange for funding. So at the moment, no drugs have been approved specifically for pre-diabetes. And that means that doctors are quite limited as to what they can prescribe. But the pharma companies are testing dozens of drugs aimed at pre-diabetes in the hopes of tapping a potential worldwide market of hundreds of millions of billions of pounds, people. And not a million miles away from this, we also have sitting alongside the multi-billion-pound diet and weight loss industry. And this looks like companies, like pharma companies like Novo Nordisk, teaming up with Noom, the weight loss app that says it's not a diet. Or it looks like GPs referring to Slimming World before even considering their medical weight bias or adequately assessing for eating disorders. Pre-diabetics are now being targeted to buy continuous glucose monitors that basically they attach to your arm, the back of your arm, and they transmit data to your mobile so you can monitor your blood glucose levels. It sounds maybe kind of helpful, but it's not. I just don't see how this is helpful for people, and they're bloody well not cheap. So I'm seeing other nutrition therapists and consultants touting use of continuous blood glucose monitors as if it's like a really important medical necessity for everybody, regardless of health or blood sugar status. And that's scary because there are risks of causing more harm than good here. And I said it in terms of what I'm about to say now. I've said this before, but I want to repeat this with a particular reference to diabetes. There has not been one study ever to show that a population can lose and maintain sufficient weight in order to prevent diabetes over the long run, never mind safely. And of the studies that have attempted to prove this, they won't show you the dropout rate, they won't show you any data beyond 2 years, and they won't share how many participants develop disordered eating behaviour as a result of their interventions. So much of the diabetes world is convinced that weight gain causes diabetes, and hence the focus is heavily on weight loss. And diet culture and weight stigma run rampant in diabetes care. So I sort of wonder if only they could see these folk as human beings, not data, not people to be shrunk down and changed. If they could consider weight gain as a symptom, not the cause of diabetes, that would be a start. So, but instead we're kind of stuck in like two separate silos. We have the weight inclusive care team, like me, that embraces health at every size and intuitive eating, who want to move away from the weight and numbers because they and I prioritize well-being and health over weight. And then we have the weight normative camp who remain ignorant to the data that shows focusing on weight is not effective for most because of the high rates of weight regain and cycling from their weight loss interventions. And these are all linked to adverse health and well-being. So its predominant focus in terms of focusing on weight typically fosters stigma in healthcare and society. And data shows that weight stigma is also linked to adverse health and well-being, such as increased risk of diabetes. Now, I'm not saying weight-inclusive approaches like HAES and intuitive eating can't coexist with diabetes care, but it should at least be, can we attach it? I get that it's hard. It is two very different philosophies and approaches, but it's really what I'd like to see. And here's why. Because diabetes management recommendations and eating disorder behaviours can look really similar. Diabetic care usually comes from a place of recommending weight loss, counting carbs, maybe constant glucose monitoring, avoiding sugar, labelling food as good or bad. In real life, this is typically very problematic for people's mental and physical health. There's the potential to get sucked into perfect number crunching, food hyperfocus that invites food preoccupation, anxiety, shame, and guilt. And these sorts of recommendations that ask people to focus heavily on weight and food are likely to lead to restrict binge cycles, which are also so problematic for people's mental and physical health. And you know what? Binge eating disorder is the most common eating disorder among those with type 2 diabetes. And restrict binge cycles can absolutely play into destabilizing blood sugars. That can be dangerous, particularly if somebody is already experiencing insulin resistance or problematic in managing their blood sugars. But what's also worrying is, the associated weight cycling is shown to drive increased insulin resistance and increased risk of diabetes. And when we talk of binge eating, and based on its definition where there's a sense of loss of control, it's not uncommon to develop a type of conditioned negative bias towards eating, particularly specifically towards carbs, and to be honest, to having diabetes. And restrict binge cycles can be really unpleasant. And what ends up happening is you assume the food you restrict and then binge on is what makes you feel so crappy because you've eaten too much by the nature of it, which one can feed into greater restrictive behaviours and spiralling, and two, that feeling crappy can be so easily misattributed, leading to self-blame, which feeds the cycle more. You kind of getting the picture? So we get this message, you can cure your diabetes, and it gets messy. So, of course, you sign up to the I want to be cured because why wouldn't you? We're told it's a terrible thing. And more than likely, you'll be prescribed a low-calorie and or low-carb diet. And if you can sustain it and not find yourself binging and restricting, you may well find that your blood sugar drops. Now, that doesn't mean you've cured your body of diabetes. It means your blood sugar is lower. And what this shows us is that we don't really have a solid definition of what it means to cure diabetes, because it isn't just lowering your blood sugar levels. And I had a really cool analogy a little while ago about curing diabetes and wearing glasses. And it went something like, so someone has poor eyesight. Let's say I'm thinking of myself here, I can't read anything in small print and you're kind of squinting. So you're given reading glasses to help, but they choose not to wear the glasses. And actually they made that choice to not read anything for the rest of their life. And That's cool. You don't need glasses to read anymore, but that doesn't mean your eyes are okay and that you're cured. And at a push, you maybe could get through life without reading, but it's probably going to be a sad existence. And similarly, you could get through life not eating carbs, but what's the cost going to be? Would it be worth it? Not if it's going to play out into binge eating disorder or bulimia nervosa or anxiety around food, missing out on things in life. And what is often missed out of the conversation is that folks with diabetes struggle with disordered eating and eating disorders at an alarmingly high rate. And as a professional working in this field, we have to deal with the disordered eating or eating disorder first. That's where the intuitive eating can fit in, because here are some more stats. Disordered eating behaviours affect 40% of folk with type 2 diabetics. Nearly 38% of females and 16% of males with type 1 diabetes between the age of 12 and 21 engage in disordered eating behaviours. Adolescent females with type 1 diabetes are more than 2 times more likely to develop an eating disorder than those without. 31% of women with type 1 diabetes report insulin restriction to instigate weight loss. Bulimia is the most common eating disorder among those with type 1 diabetes. And you know, the likelihood is that all these statistics underestimate the real number of people with diabetes who are struggling with eating disorders or disordered eating, because we don't have the right screening tools and there isn't enough research into this sort of overlap between diabetes and eating disorders. That's a big problem. It's also what I see in terms of looking at eating disorders and neurodiversity, or eating disorders and weight loss surgery. And I think another big problem is when healthcare professionals haven't personally experienced disordered eating, or they haven't identified with it. Not to say that they need to experience it, but they just don't get the real life impact of recommending weight loss or asking someone to closely watch what they eat. This is why we need more eating disorder education in healthcare settings. GP knowledge around eating disorders is diabolical. And for the love of God, please stop providing medication for the sole purpose of weight loss, promising this will cure them. Please stop recommending weight loss surgery as a cure for diabetes. And that might be, go listen to episode 9 in season 1, The Truth About Weight Loss Surgery, for more on that. And please, can you look beyond the HbA1c as a sole definition of health? So my take-home message today, before we kind of dip into the pick and mix, is our bodies need carbs. They function better with carbs, even for people with diabetes. And yeah, you can eat carbs and have a peaceful relationship with food. And actually, these tend to go hand in hand together. And you can take your meds. This isn't something I'm going to get into much right now, but there is far too much shame about taking medication to support your body in diabetes care, whether that's something like metformin or insulin. It's okay to take medication. Now, hang on just for a moment. My pick and mix is coming up next, and I'm going to give you some tips that I think you'll find helpful, whether you've been asked to get tested for prediabetes, have recently been told you have prediabetes, or are currently managing diabetes, but are conscious of a tricky relationship with food. Back in a sec. Okay, here are some nuggets and reminders you might find helpful. You can jot them down, but I'll also put a copy into the show notes for you. Right, the difference between type 1 diabetes and type 2 diabetes is not who caused the diabetes and who didn't. So to explain, type 1 diabetes is an autoimmune condition. The immune system attacks the pancreas, so the pancreas stops making insulin, so it needs to be administered. Type 2 is when the pancreas can make insulin, but the insulin can't connect with the cells properly and do its job. Okay. Either way, it's not your fault. Someone can be diagnosed with any kind of diabetes in any body size at any age, eating any kind of diet. Insulin does not cause weight gain. saying it does to induce fear into patients is fat phobic and problematic. And I see it a lot. Yes, type 1 diabetics may experience weight loss when they can't make insulin. This is because there is something wrong. It is not a good thing to happen. So when reintroducing insulin in order to keep you alive enables weight restoration, it doesn't mean that the insulin is causing the weight gain in the way that people tend to talk about it. Chuck your scales away. They are likely causing more problems than they are solving. And your weight tells you so little about your health and nothing about your worth. Eating to be good at the expense of your emotional health is not healthy. Restricted eating is not healthy eating. If you are feeling all consumed by food, if you're hyper-focusing on your body and what you're eating in a way that it's taking over all your thoughts and life, it's not normal. Please seek some help. If you want to get in touch, I am here. You can learn to eat intuitively and manage diabetes. And we know that it brings improvements in blood glucose independent of weight. Revisit your boundaries. Stay away from anything and anyone who reinforces the idea that larger bodies are wrong. This is about advocating for yourself. If anyone suggests that we need to do everything within our power to keep our bodies small, run away, because this further perpetuates disordered eating and body insecurity. Know that you deserve help. I know it can feel uncomfortable asking for it, but it's worth it, and people are out here to help. Check out the Health at Every Size health sheet for type 2 diabetes that is also in the show notes. It gives a really good understanding about what type 2 diabetes is, how it can be managed from a completely weight neutral perspective. So that might be helpful. So that is it for this episode, my friends. Thank you for joining me. If you want to get in touch, you can email me at mel@wakemannutrition.com, or you can come find me on social media on Instagram or TikTok, because you may have some questions and I'm happy to answer them. Now, it really helps me spread my message and help more people when you tell me or tell others you love listening to Cake Over Keto and perhaps even found something really helpful. So can I ask you to tell one person about this podcast? And if you can leave me a review, 5 stars would be lovely, on your podcast platform, I will be forever grateful. So join me next time as I explore the relationship between anxiety and food issues, anxiety around eating, and finding effective ways to cope and help you manage anxiety. In the meantime, take care of yourself. Know that you are enough, always, and I'll see you next time. Thanks.
This has been a Monkey Pants Productions podcast.